I am an advanced clinical practitioner in training currently, and I work from a GP surgery seeing patients either face-to-face or speaking to them over the telephone after a GP has triaged them from the list. So I was with an ambulance service for 7 years, working in a large inner city area of Birmingham and also in the rural shires of Worcestershire. Across that time I worked on frontline ambulances as a paramedic and also a clinical mentor, which was training, developing new staff, existing staff, and helping out with audits and other sort of managerial work. All that time I was on ambulances attending to sick patients. And then since I've joined the primary care role, which I've been in for about 12 months, I see and treat patients in a surgery setting and often go and do home visits where they're in their own environment and we can see, treat and hopefully assess them there. So the difference between emergency care and primary care is that we respond to people on blue lights and sirens. We see them in their home and often we have to find an alternative pathway, or we take them to an A&E department, and that's where the decisive and critical decision making comes in to spot the sick patient and need to move quickly and do interventions, or we can go at a steadier pace and take them in. Whereas in primary care, the transfer of skills is quite good, so I think that we can see and spot sick patients quite well, but it's a very new skill set for the paramedic where we have to now see, treat and manage long-term conditions as well as acute and on-the-day illness. So as an advanced practitioner and a developing skill set of the paramedic, we are seeing patients across the age range with all sorts of presentations, and the new skill set we develop is about diagnosing and also long-term management. So as a paramedic on an ambulance, you'd normally see a patient, treat them acutely and never see them again. Whereas in primary care, we actually have ongoing follow-ups with the patient. We may need to adjust their medication, refer them to secondary care, which is a brand new skill set, but quite an exciting skill set. Patients can access the service I provide by either calling in to the GP surgery and speaking to one of the reception team, or they can use the online patient triage which operates across the whole of the Worcester City PCF. Yes, certainly. When I see students that have come through and mentored, they've had an experience in the retail sector or customer-facing experience, so they can actually talk to the patients. Because believe it or not, before you treat a patient, you have to ask them a question, you have to ask them a history, and if you're able to communicate with people, it's really good. Students that I've seen who've been carers in the past, they've made excellent paramedics because we can teach you the skills, but the communication and the customer facing or patient facing is something that needs to be learned prior to the job.